57% studies have shown in US that the most commonest cycling injury is actually neck pain. I'm Dr. Sabbir. I'm from Pantai Hospital Ampang. I'm a consultant orthopedics and sports surgeon. Majority of my patients are usually sportsmen, and I do a lot of shoulder, knee and ankle arthroscopic surgeries, mostly for sports injuries. The most common injuries that cyclists and runners will usually get. I'll start off with runners, those who do running on a social basis or at a competitive level. Most of the time suffer knee injuries, especially anterior knee pain. Anterior knee pain means pain in the front of the knee, right? And that is most likely about 60 to 70% of the injuries. Anterior knee pain most of the time is because of patellofemoral syndrome. This actually happens when the patella, the kneecap, grinds against the trochlea, which is this part here of our femur. Friction between the undersurface of the patella and the femur, the trochlea here. So this excessive wear causes anterior knee pain. So sometimes when you have a lot of anterior knee pain, it's not usually because of an ACL injury that you may think where most footballers or basketball players get. This is because of the patella rubbing against the trochlea. Early treatment does not mean that you need to get an operation done, no. For patellofemoral syndrome, what happens is there could be maltracking. When you're having flexion and extension, your patella may not be centrally aligned, all right? Your patella has a ridge here, okay? So this ridge has to be aligned in this. So if it's not aligned properly, you can get wear. But if it is aligned centrally, you don't get the patellofemoral syndrome. So how can we, without doing any operation, make sure that our patella is aligned or does not maltract? So runners, if they have this anterior knee pain, the first thing they can do is actually wear a brace for a short period of time, 4 to 6 weeks, and do some muscle strengthening, muscle conditioning, especially for the knee joint. To stabilize it, we need a very strong VMO. It's one part of our quadriceps muscle. This stabilizes the knee. Common injuries in cyclists, actually, I'm going to break it up into acute and chronic, because acute means something which can happen immediately. For cyclists, of course, like accidents, falls, which can cause you to have head injuries, fractures. But I will go more into the chronic injuries that you will have on cycling for long periods of time. 57% studies have shown in US that the most commonest cycling injury is actually neck pain, cervical pain, neck pain. Why is that? It's because of the posture, especially in road bike. You know, the posture that you are cycling in. If you do not have proper saddle height, if your handlebar is too low, this can cause severe spasm of the paraspinal muscle around the neck, and because of the poor posture. And so that is the commonest injury. And what causes it is actually the muscle spasms. So that is number one. Number two is knee. Some of the commonalities that runners and cyclists have is actually the anterior knee pain again, patellofemoral syndrome. Why? Because of the flexion extension, which wears out this joint. So this is another thing which can cause you to have pain. Then comes low back pain. Why do you get, apart from cervical, you get low back pain? It's of course the posture. In your neck, when you're riding cycles, your neck is always extended, all right? Extended means it is not in your normal position. If you're sitting down, you're always in a looking up position. And when you're cycling, that's what you're doing, because you're looking far ahead. But your whole body is hunkered down, isn't it? So that causes to have neck pain. Apart from that, you will also have hip pain, and you can also get saddle pain, you know, because of the seat. Sometimes if you're using the wrong seat, women and men have different anatomies. So sometimes if you're using the wrong seat, you will get saddle sores. These actually are modifiable because you can change your seat. If the height of your saddle is not correct in relation to the frame of your cycle, to your height, increase the pain in your joints. Other chronic injuries that you're going to get is actually in the hands or in the wrist. Why? Because when you're riding, especially road bike or even mountain biking, a lot of your body weight is actually on your hand, which is holding your handle. Sometimes cyclists will experience numbing pain of the little finger and the ring finger. Why do they get this? It's because of the position of the hand on the handlebar and the weight which is compressing the nerve. We've got two major nerves here, right, and controlling the small muscles of the hand. So when this gets compressed, especially on the lateral side, on the outer side, you get numbness. And this, on a long term, can cause you to have severe pain. Apart from just numbness and the pain over your palm, you can have wrist pain, chronic wrist pain, sometimes elbow pain, and all that actually boils down to the height of the stem of your handlebar and the position that you're actually riding. So that is why it's very important to get a proper setting done by an expert.